Subchorionic hemorrhage. Why do we get them and how common are they? Behind me is an ultrasound of an example of someone who is pregnant that has a subchorionic hemorrhage. I'm going to try to explain to you in the most normal terms of why they happen and how common they are. So this is an ultrasound. This is the gestational sac. Inside is the baby, and under the gestational sac is another area that appears black. That is what we consider a subchorionic hemorrhage. Basically, the way pregnancy works is when the swimmer meets the egg, you conceive. Well, that seed has to implant somewhere inside of the uterus. This is the uterus. So wherever that seed implants inside of the uterus, it's going to disturb some of the blood vessels within the uterus. So sometimes when those blood vessels inside the uterus are disturbed while the pregnancy is implanting itself within the endometrium, there could be a little bit of blood that pulls around the sac of the baby. Some moms might have small subchorionic hemorrhages, and some moms might have really big subchorionic hemorrhages. In the example behind me, I would consider this subchorionic hemorrhage or implantation bleed to be small because when you look at it, when compared to the pregnancy, this is a lot smaller when you compare it to the big gestational sac and the baby that is within the gestational sac. My name is Christina. I've been doing ultrasound for 18 years. In my experience, I probably see this about 25% of pregnant women. I have done a ton of OB throughout my career, and I now own this ultrasound business. I've been in business for 6 years. So I feel like I see it 25% of the time in pregnant women. And a lot of women don't even know they have one unless they get a very early ultrasound, or sometimes mom may start bleeding. No one likes to see blood in pregnancy. It would freak me out as well. But I have had women bleeding buckets in pregnancy, and I put my camera down and the baby's fine. There are other reasons that a subchorionic hemorrhage can occur, but I would think that this is the more common reason. Again, if you see blood, it's always a good idea to call your OB, but just try to be positive. It doesn't mean that something bad is going to happen.